if I was in a room with Larry Fink, I would say, look, what you do at BlackRock is a solution, that you're managing money, you're managing wealth for all Americans to save for their retirement. That's a really good thing to do, and Americans need to build more wealth for retirement. But if you think, Mr. Fink, that people working longer, maybe just a 1 year or 2 years longer, will mean that people won't go into their old age without being downwardly mobile into poverty from being a middle-class worker, or you think that working longer will maintain people's living standards, you'll be wrong for 8 reasons. The first reason is that he and everyone else might think it just makes sense to work longer because people are living longer. And that's actually not true. Not everyone is living longer. There is a slice of the population that have had good health care, have had the kinds of jobs that enhance their health and their well-being and their skills, and they're living longer. So white men are definitely living longer than they had before. But there are some parts of our economy, of our America, where actually the longevity is going down. Deaths of despair, the suicides, the opioids, the addiction, even the kinds of jobs that people have are foreshortening their lives. So the inequality of longevity and healthy longevity is really disproportionately distributed, so they can't work longer. I have 6 others.
But let's harp on that for a moment, because a lot of people on Wall Street believe that working longer is a solution just because of how healthcare has gotten better. Let's get a little more specific on who it doesn't work for and how large is that population not being addressed if this is the solution?
Well, I've been in these rooms for about 40 years. That's how long my career has. And ever since I started, when Social Security was being cut and pensions were going on the wayside and there were more 401ks or do-it-yourself type systems, we all knew that people would not have enough given that we did not have a good pension system. And so people thought, well, for the small group of people who are blue-collar workers, bricklayers, they will be able to be disabled earlier. But for everybody else, the work is going to get easier. Well, in 40 years, that has not happened. Now, think about it for a while. A lot of jobs that aren't blue-collar work have become pink-collar. And pink-collar jobs are jobs that women do, very much in the service sector, taking care of older people, taking care of children. That requires a lot of heavy lifting, a lot of stooping and bending, a lot of physical activity, and those jobs break bodies down. There are also a lot of light blue-collar jobs or semi-pink collar jobs that require a lot of engagement with the computer. And the computer has made some aspects of jobs easier on the knees, but the requirements for intense concentration, keen eyesight, and actually be able to speed up your work because of increased surveillance has actually made those jobs harder too. And when you add up all the complexities involved in jobs that older people have, those jobs actually can raise cortisol levels, increase inflammation, and cause more metabolic disorders and early death. So a lot of the jobs that people have or are expected to have in old age are actually the kinds of jobs that will break bodies down and are accelerating sickness.
That's the impact on the individual. It seems like the retirement burden in a lot of ways has shifted from employers to the individual. At the same time, there's a question of whether a lot of these jobs will be supported at that age level. How do you see that conundrum working out? Yeah, well, there are some businesses that are hoping that there'll be a big supply of desperate older workers ready to work. Those jobs are in home health care and personal care. So we have one of the biggest industries, everybody, is in this personal care. They're destined to add over 1 million jobs in an economy where we'll only add about 11 million jobs over the past 10 years. A good 10% of the new labor force will be these jobs in just that one occupation.
But business services, janitorial work, again, disproportionate amount of older workers. I think those businesses really like the fact that these workers are very, very cheap. And they're very desperate. The fact that jobs are breaking down their bodies really isn't of a concern of the employers. But part of the crisis is that the lucky ones will be able to get those jobs. The part of the crisis that I think that many experts, including Larry Fink, doesn't understand is that most people cannot decide when they retire. They are retired. They don't retire. The verb and the agent is really on the wrong person. So 52% of people who say they are retired said they were forced to retire, either because of their knees or their metabolic disorders or just the stress of the job they couldn't take, or they had to take care of their spouse, but also because they were pushed out or laid off. So this idea that workers can just decide to work longer is also a myth, because most people cannot decide whether or not to work or not.